We are the Gujarat Technological University. Since its inception over a decade ago, GTU has been empowering young and curating minds to realize their true potential. Over 4 lakh inspired students are enrolled with one of the premier academic universities in India. With more than 450 affiliated colleges in its fold operating across 5 zones of the state, GTU, the International Innovative University, your place to move forward.
Welcome to PharmaJosh YouTube channel. Today we discuss about the basic principle behind the pharmacodynamic activity. First one, pharmacodynamics. What is the pharmacodynamic? What the drug does to the body when it enters. That means the effect of drug to the body. This type of condition we can say this is the pharmacodynamics. What is the exact meaning of this pharmacodynamic? So let us here you can see the pharmacodynamics, the study of biochemicals and physiological effects of drugs and study of mechanism of actions in the living tissue. That means mechanism of action, first one this is the pharmacological action and second is the mechanism of action. Mechanism of action, that means that the drug molecule those are entering into our body, that means our cell, and binding with the specific receptor and produce its action. This type of the condition we can say this is the mechanism of action. Shortly we can say how the drug produces its effect. This is called the mechanism of action. And second one, this is the pharmacological action. That means after the binding with the receptor, the drug produces its action at a different organ. This type of condition we can say this is the pharmacological action. These pharmacodynamic or mechanism of action, those are based on the basic principle. In these basic principle that behind, first one this is the stimulation, second one this is the depression, third one this is the irritations, fourth one replacement, fifth one cytotoxic action, sixth one antimicrobial actions and modification of immune status. So this is the 7 varieties of the drug action principle. Our drug are produce its action. First one, stimulation. The name itself says that becomes stimulate. That means here you can see the selective enhancement of the level of activity of the specialized cell. That means the any drug molecule, here example is the adrenaline. These adrenaline binding with the beta-1 receptor on the heart, and due to these adrenaline that produce the stimulatory, that means increase the heart rate. This is a contractile effect of heart. This is stimulation. So this type of the basic principle of drug actions. Another example is the pilocarpine is the drug. Those activate the action of the salivary gland. Due to this pilocarpine, saliva are increased in our human body. This type of this stimulation, that means increase the action. This is the basic mechanism of drug action. Second basic principle is the depression. That means inhibit the action of particular receptor by the drug. That means selective diminution activity of specialized cell. That means barbiturate. Those we are using the CNS depressant drugs. These are the drugs we are using. The patient are entering into the CNS depressant, decrease the activity of CNS. Quinidine is the sodium channel blocker that decrease the contractile effect of heart. That means this depression action. This is the another basic principle of drug actions. Certain drugs stimulate the one type of cells and depress another type of cell. Example is the acetylcholine. Sometimes we have one drug, but that produces the different varieties of action in the different organ. First one is interstitial smooth muscle, that means in the intestine, acetylcholine binding with the muscarinic receptor and that give the contractile effect. But this acetylcholine binding with the muscarinic receptor on heart that produce the inhibitory effect, that means decrease the contractile effect. So this is the one drug having the different varieties of the pharmacological actions. This is another varieties of the drug actions. Third is the irritations. Non-selective noxious effect, less specialized cells. That means mild stimulatory effect, slightly stimulatory effect we have to finding. Here, the bitter increasing the saliva and gastric secretion. That means bitter things we are using as a drug that increase the saliva and gastric secretions. This is the irritatory type of effect. And if we are using the more and more bitters, that produce the inflammatory type of the reaction. This is the third varieties of the basic principle. Replacement therapy. Replace, name itself says the replace. Suppose in our body something are deficient level, those we have to use it from the outside by in the form of the drug or in the form of the injectable route or oral route. This type of the condition we can say this is a replacement. Suppose we have we are using the levodopa drug in the Parkinson disease. Parkinson disease is mainly occurring or responsible causes is the deficiency of dopamine. These dopamine are obtained from the levodopa. So this is a replacement. Levodopa is replaced by, Parkinsonism mainly occur by the levodopa, and levodopa here we have to administer, that means increase the effect of Parkinsonism decrease. Insulin that we are using in the diabetes mellitus. We are very well known in the diabetes condition, blood glucose level are increased along with insulin level are decreased. But if you have to use the insulin, and these insulin are responsible for decrease the diabetes. Same as the ions in anemia. We are very well known in the anemia condition, we have to finding the due to the iron deficiency. In ions you have to supplement by in the form of oral conditions. That may be here one example are given to here. This is ion tonic that having ions, and this replaced by this therapy. So this is a replacement. Cytotoxic effect, name itself says cytotoxic. Cytotoxic means the cell are killed by or cell having the toxic effect by outer substance. This is called cytotoxic effect. Selective cytotoxic action for the invading parasites or cancerous cells. Means we are using the drug against the cancerous cell or some parasite. This type of agent we can say this cytotoxic agent. Antibiotics, antivirals and anti-cancer drug. So this is cytotoxic agent, those we are using against the infections. Same type of another drug, this antimicrobial agent. These are the drug used against the different varieties of microorganism, that may be bacteria, fungal, virus, protozoals. This is the microbes. And these microbes produce the different varieties of the infection, and these infection is eradicated or arrest or prevention by using this antimicrobial agent. Example is the antibiotics. And modification of immune status, that means modify our immunity. Suppose we have decreased the immunity, during those time we are taking the some varieties of the vaccine, SARA, levamisole and corticosteroids. That means increasing our immune status. Suppose we are using the polio vaccines because of the increase our immunity. In the small child we are using the BCG vaccine that increased our immunity. So just this is the during those time we have to using. But some of the another drugs we are using in the decrease the immunity, like in the when the person are suffering with the person are suffering with specifically the organ transplantations. During those, that may be kidney transplantations, bone marrow transplantation. During those time, doctor may prescribe to us immunosuppressive agent like the levamisole and corticosteroid are the example of immunosuppression. During those time, we have to decrease our immunity. This is a modification of immune status. So this is the some of the basic principle of drug actions. During this mechanism, the drug are affecting to our body. Thank you very much for watching PharmaJosh YouTube channel.